Now let's get into diuretics. Diuretic medications primarily work in the kidneys to increase the excretion of water and electrolytes from the body. There are different types of diuretics, each targeting specific parts of the kidneys' filtration and reabsorption processes. The loop diuretics, these act on the ascending loop of Henle in the kidneys, inhibiting the reabsorption of sodium and chloride, which leads to increased urine production and fluid loss. Thiazide diuretics work in the distal convoluted tubules, reducing the reabsorption of sodium, chloride, and water, which results in the diuresis and decreased blood pressure. Potassium-sparing diuretics act in the collecting ducts and decrease the excretion of potassium while promoting the excretion of sodium and water. Carbonic anhydrase inhibitors affect the proximal convoluted tubules, reducing bicarbonate reabsorption and subsequently sodium reabsorption, leading to diuresis. Lastly, osmotic diuretics are filtered by the glomerulus. Lastly, osmotic diuretics are filtered by the glomerulus, but are not reabsorbed. They increase osmolarity in the renal tubules, preventing water and reabsorption and causing diuresis. Each type of diuretic has a unique mechanism and application. They are often prescribed to manage conditions such as hypertension, edema, and congestive heart failure. It's important to note that the use of diuretics should be monitored by a healthcare professional, as they can affect electrolyte balance and kidney functions. So we'll be going over each medication and how they work, the medications in their class, and the different characteristics you need to know for the NAPLEX exam for each medication. Thiazide diuretics exert their influence at the proximal distal convoluted tubule. So here are the list of thiazide diuretics. You can see here hydrochlorothiazide, microzide, and so forth. I would recommend knowing the brand and generic medication name and the MOA and where it works. And it's important to know that thiazide diuretics cannot be used in patients with creatine clearance less than 30. The only thiazide diuretic that can be used, which is considered a thiazide-like diuretic, not a pure thiazide diuretic, is metolazine, Zeroxyl, which is given daily. And this could be given to patients with creatine clearance less than 30. So this is the only thiazide diuretic that can be given to a patient with a creatine clearance less than 30. And loop diuretics is recommended for patients who have creatine clearance less than 30. But it is important to know that metolazone is the exception to that rule. Now let's move into thiazide diuretics, cautions, and side effects. And I would recommend knowing these for the NAPLEX exam. There are quite a bit of them, but they are important since thiazides play a big role in hypertension management. So these include sexual dysfunction, sulfa allergies, diabetes, dyslipidemia, gout/kidney stones, renal failure. It is important to note that thiazide diuretics cannot be given to patients with creatine clearances less than 30, except one medication, which is a thiazide-like diuretic. So which medication is that? Correct, metolazine. So, correct, metolazone. So, correct, Zeroxyl. So it's important to note that and to know that for the exam. Next, it could cause hyponatremia. As for electrolytes, it does deplete all electrolytes except calcium. And it does increase glucose, uric acid, and calcium. So I like to think of it as guac. So thiazide diuretics increase guac, which stands for glucose, uric acid, and calcium. Next up, let's get into thiazide drug interactions. So thiazides could interact with several medications because it does deplete several electrolytes. But here are the notable ones for your NAPLEX exam. A good mnemonic to memorize them is DALE, which stands for digoxin, allopurinol, and lithium. And it's important to know, obviously later on we'll get more into it, but digoxin toxicities could be due to a decrease in potassium and magnesium, while lithium toxicities could be due to a decrease in sodium. Next, hold on to your hats because we're about to ride the loop diuretics roller coaster. These diuretics are like the rock stars of fluid management, setting up camp in the thick ascending limb of the loop of Henle. First up, we've got the rebel ethacrynic acid, which has no sulfa in it, which is the only loop diuretic with no sulfa. Next, we have furosemide, Lasix. Next, furosemide, Diuretics. And lastly, but not least, bumetanide, Bumix, which has a maximum dose of 10 milligrams per day. And you will have to know for the exam their conversions between each other and IV to PO, which we will go over and review later on in the video as well in later videos. So loop diuretics are very important because they can be given to patients with creatine clearances less than 30, as you can see here, which you can't give with thiazides. So that's why it's important. If a patient has a creatine clearance less than 30 and we need a diuretic, loop diuretics are perfect, and they can be used. Their indications are edema, hypertension, and hypercalcemia. Now, for the most part, loop diuretics are very similar to thiazide diuretics, which include their sulfa allergy, sexual dysfunction, all of those side effects. But the differences are that it decreases all electrolytes and it increases glucose, uric acid, and lipids instead of increasing calcium. The main differences between them in terms of their side effects profile is loop diuretics is ototoxic and it is kidney okay, meaning you could give it to patients with creatine clearance less than 30. So a good way to remember this is if you see loop diuretics, you could use the two O's in loop as a reminder as ototoxic and okay to give in patients with creatine clearance less than 30. Last but not least, we have case-sparing diuretics, which work in the distal convoluted tubule and the collecting ducts. And these diuretics are not to be used alone. And here is a list of them, which include the main ones being aldosterone antagonists, which is spironolactone, aldactone, and eplerenone Inspira. And it is important to know that spironolactone, a side effect to this medication is gynecomastia. So on the NAPLEX, they could give you a patient scenario where a patient comes into the pharmacy saying they started a new medication and they noticed that, the male started to grow, man boobs. And in this scenario, they could ask you which medication could have been a cause of this. And it would be up to you where you would have to know that that is a side effect of spironolactone. So the main side effects of these diuretics include hyperkalemia, which makes sense, hence the name case-sparing diuretics, hyponatremia, rash and headache,